Hi there, I am Dr. Melissa Suhu, licensed clinical and health psychologist in private practice with Sequoia Counseling in Orange County, California. I provide online counseling to adults living with depression, anxiety, and medical conditions. Today on the blog, I'll be talking about the effects of anxiety and anxiety-related behaviors upon women's health. As we know, there's a mind-body connection that impacts our physical and psychological or emotional well-being. What happens to the body affects our thoughts, beliefs, and feelings, and vice versa. I'm going to start by providing 3 examples of how our minds can negatively affect our health as women. I will finish out this video blog with a few action steps that you can take to improve your physical and emotional health now. The first health condition I'll be talking about is diabetes. About 10% of women in the United States are diagnosed with diabetes, and 32% of women are diagnosed as pre-diabetic based on their fasting glucose or A1C levels. Stress can contribute to elevated blood glucose levels and lead to the development of type 2 diabetes indirectly via less participation in health behaviors such as having good diets, regularly scheduled meals, and exercise that target diabetes prevention and management. Number 2, another health condition affected by our emotional and psychological health is heart disease. Approximately 25% of women in the United States are diagnosed with high blood pressure or hypertension. High blood pressure is a risk factor for stroke, coronary heart disease, or the narrowing of the arteries, and impairments in kidney function. High levels of stress can briefly increase blood pressure. Stress coping behaviors such as emotional eating, smoking, or drinking alcohol can worsen high blood pressure. Learning how to manage stress and anxiety can lower the risks of developing heart disease. 3, the third health condition is insomnia. Estimates aren't precise because it's not easy to record all the different women who might be having sleep difficulties or insomnia, because many times we just work it through on our own. But approximately 20 to 40% or more of women in the United States complain of insomnia or poor sleep quality. Sleep problems may be due to medical or biological causes, such as hormonal changes, medical conditions, or side effects of medications. But sleep difficulties can also be impacted by anxiety, depression, and high stress levels. Psychological health is just as important as physical health when we talk about overall health outcomes. Following a plan to manage your thoughts, worries, and stressors can be a prescription just the same as taking medication, going for walks, or following through with medical treatments with respect to disease prevention and management. So we talk about unhealthy thought patterns, and how would we know that we're not having good thought patterns, good habits? One unhealthy thought pattern is this concept of catastrophic thoughts and worries. So the first thing to be aware of with catastrophic thoughts and worries is, what are they? How do you know that you're doing them? When we engage in catastrophic thinking, we find ourselves getting stuck in thoughts that have irrational or worst case scenario type outcomes that bring about strong anxious feelings in the worrier. So some ways to know if you're worrying or doing too much catastrophic thinking is to ask yourself a couple of questions. First, are these thoughts that I'm having leading me to take action, or am I just stuck with thoughts? So one example of this perhaps is researching medical conditions on the internet, which I think we're all prone to in this current day and age. But when you don't really understand the information, you're not really discerning the quality of the information, and it just leads to more anxiety and more questions, then we can probably say that this is a catastrophic thought process or unproductive worrying. Another example of this unproductive thought process and worrying is when the questions that you're asking are not answerable. So, for example, asking what if questions, imagining hypothetical situations, or trying to understand how others think or feel without really knowing. In other words, to try to mind read or try to analyze situations where there's really no information for you to be making those conclusions. Another thing, as we talk about this catastrophic thoughts and unproductive worry, is to understand what the function is, because obviously this is a habit that develops over time. It's a coping strategy. It's a pattern that arises whenever faced with a certain type of situation, such as a crisis or something unfamiliar. So functions might be things like, are you trying to get control over something? Are you trying to prepare yourself for something? Maybe you're somebody who gets anxious when you don't have control and there's uncertainties in the situation that you're in. Some research has shown that women tend to engage in these catastrophic, unproductive, worrying behaviors more than men. I'm not really sure exactly why. It's probably a lot of different factors, but it could be because of a woman's desire for optimal outcomes, such as pleasing others or not troubling anyone. Not to say that men don't have these same types of concerns, but I think they just figure we'll deal with it if it happens, and they're very pragmatic, where women can get caught up in these little finite details. So values such as these, trying to please others or not troubling others, can make challenges more complex for women to adapt or resolve. So another way of coping with these thoughts is to find yourself engaging in relaxation techniques. The reason why I say relaxation techniques are important is because a lot of times when we get very anxious and worked up, especially if we're in a crisis type situation as women, there is a flooding of emotions. There is a flooding of a stress reaction. Maybe you even feel a little panic-like in extreme situations. When you focus on your breathing, when you focus on relaxation, you're able to calm down those physical reactions, the emotional reactions, such that you're able to think more clearly, step back, talk yourself down from the ledge, whatever the case be. Two types of relaxation. One is active, the other is passive. And one is not better than the other. It's more about finding what works for you as an individual. So active relaxation could be things like going for a walk while listening to some soothing music. It could be doing some stretching, or progressive muscle relaxation is a very common way to relax that is active. And passive relaxation is more like doing the deep diaphragmatic breathing or belly breathing, mindfulness techniques, or perhaps even like some guided imagery type exercises where you're using more of your imagination or some kind of a thought process and not really doing a lot of physical movement. Whatever the relaxation technique is that you would try, you should be using your breath as the foundation for the exercise. Challenge yourself to deep breathe for relaxation uninterrupted for 2 minutes daily. And the reason why I say daily is because then your body starts to know what it feels like to be relaxed and to not be overwhelmed with these different thoughts and worries. A lot of times we only do the relaxation exercises or the breathing exercises when we remember, when it's convenient, or when we're really feeling overwhelmed. And the issue with that is it's just one of many habits that we would do. Something's better than nothing. This is true. But if you can develop a lifestyle or a habit of practicing these relaxation techniques, it will be much more effective in terms of helping you when you're going through stressful situations. The third thing to do to combat these worries and unhealthy thought patterns, catastrophic thinking, is to also identify 3 self-care activities that you can do when you're feeling stressed or needing a time out. Ideally, these would be things that are convenient, don't require a lot of effort for you to do. They're accessible. So perhaps there could even be a relaxing component, such as getting a massage or spending time in focused gardening as your self-care activity. So in a way, you're kind of incorporating the relaxation along with the self-care activity. For me, as far as self-care goes, for example, I would think of things like going to some place that I really enjoy, where I don't have to think about problems or taking care of people, or maybe going and doing some exercise where I'm not allowed to think about, or I'm not able to think about issues and problems. I'm just focused on, not getting injured and having a good workout with what I'm doing. And so for me, those are examples of self-care activities that help me out when I need to take a break from whatever's going on in my day. Lastly, number 4 is to possibly seek professional help to get support and guidance on how to manage your worry and stress differently. So that kind of goes without saying. If this has been an ongoing pattern for you and it's really affecting your health, your wellness, your relationships, probably better to have a few sessions of therapy, get to the bottom of it, and sort of know what to expect, what can be done, rather than getting stuck in that unproductive worry process. So thank you so much for joining and for watching this video. If you found this video to be helpful, be sure to like it and share it with others who would be interested. If you want professional help to work on anxiety and physical health and wellness, you can contact me via phone, email, or through my website. Be well, and until next time, take care.